Good afternoon and welcome to our COVID-19 update for July 8th, 2020. I'll be joined, of course, by Dr. Gail Burstein of the Erie County Department of Health, and we have Karen Gambino from Deaf Access Services offering the American Sign Language for our friends who are hard of hearing. As always, we have important provisos, just so people know that the information is provided is as accurate as was put in the presentation. There is often new information. There actually was some new information that was received after this was put together, and we'll try to bring that up to date as we move along. I just want to remind everybody that we are constantly dealing with in some ways evolving situation. It's not the same as it was when we were in late March and April, but there are always changes and things we have to deal with as they move along. As of July 6th, there were 7,400 total positive cases. That is out of 155,744 specimens that were tested, which is a very large amount. Earlier this week, I posted a comparison once again to our partners and friends down in Cuyahoga County, Ohio, and Allegheny County, Pennsylvania, where Pittsburgh is, and we've done more than double the amount of tests than they had done down there. And I want to note for the record, these are confirmed cases through testing. There's no presumed positives. I've seen some things on social media lately where people are questioning what we're doing, saying, oh, these are all presumed cases, these are not positive confirmed cases by tests. These are all positive confirmed cases by testing. So this is not any presumed positive. And the same thing with regards to the individuals who've perished as a result of COVID-19. Unfortunately, 642 people have died in Erie County since the beginning of the outbreak from COVID-19. And these are all lab confirmed cases. These individuals were confirmed to have COVID-19 before they died. And there are no presumed positive cases when it comes to deaths associated with COVID-19. These are all confirmed cases. On July 6th, there were 39 individuals admitted to Erie County hospitals. 7 individuals were in the ICU, and 6 of those individuals had an airway assist. There was an increase, of course, for hospitalizations in Western New York to 40. There was an increase in Erie County from the day before. So we've seen the increase in Western New York. And then, of course, here's the chart as it pertains to Erie County. And you can see for the last 4 days of data, there have been an increase from the 5th prior day. Not huge increases, but every day it's about a couple new cases. So we are seeing increases in our hospitalization. And while we are not out there saying this is the end of the world, because it is still very low compared to where we were just a couple months ago, we don't like to see the hospitalization numbers going up. ICU numbers have reduced slightly. The same thing with regards to airway assists are at really some of their lowest levels since the beginning of the outbreak. Deaths, we've had a fairly low number of deaths in hospitals over the last 10 days to 2 weeks, actually. And there was 1 death in Erie County hospitals as a result of COVID-19 on July 6th. So we're not thrilled to see the number going up with regards to hospitalizations, but hospitals are nowhere near their capacity. Actually, there's plenty of bed capacity in area hospitals. 33% of all available beds in area hospitals are open, and 55% of ICU beds are open. And that includes COVID-19 patients and non-COVID-19 patients. So if you are having a serious medical issue, condition and you're worried about going to a hospital, first off, there are plenty of beds available. And secondly, you will be segregated from the COVID-19 population that may exist in that hospital. Every patient that goes to hospital is immediately tested for COVID-19. But we want people to understand if you're suffering from a serious medical condition and you're thinking, well, I don't want to go to the hospital because either crowded or they have COVID-19 patients there. First off, they're not overcrowded. And secondly, they segregate the patients between COVID and non-COVID patients. So you should not be staying at home when you should be in a hospital. Cases by age and gender. We've continued to see increases in cases, not huge compared to where we were earlier, but we've been seeing percentage increases, which we'll talk a little bit more on a daily basis. And this is broken down by age, 7,466 total cases, broken down by age. And as you see, the largest category of cases is now in the 20 to 29 age category. We have seen an uptick in cases for those that are younger. We've seen more cases actually with children lately than we'd seen before. And we're seeing a greater percentage of cases of those being under the age of 60. And right now, the largest age category is 20 to 29. And we'll talk a little bit more about that. New cases, I'm actually going to turn it over to the doctor to talk a little bit about some of the upcoming slides as I squirt this to protect it, because I want her to kind of go through some of this information and what it means. There you go.
Thank you. So, good afternoon. So, we just want to reinforce that, of late, we've been seeing more and more cases among people in their 20s and 30s. And actually, just these are data from this past week, looking at the proportion of positive COVID tests by age. So you can see that 43%, almost half of our cases of recently diagnosed for COVID-19 in Erie County were people in their 20s and 30s. So this is an alarming trend. And it's a trend I'm sure that you've seen from your media partners happening in other places of the country. So during our intense case investigations, we're asking people where they think they could have been exposed, where were they during the time back where they could have been in contact with a place where they could have been exposed. And the most common responses we're getting are travel, and that's people traveling to these states at high risk, like in the South and in the West. And also people are going to these large social gatherings, or any type of social gatherings. They're not all just large. So be careful. We know that people are getting infected by traveling to those states. We're going to talk about just now about all the reports that we're receiving so far of travelers to the states that are at high risk. I'm getting a little bit ahead of myself, but so far we received somewhere between 450, 500 reports of people traveling to the high-risk states outside of New York State. And so people are coming back and getting infected. And also with parties, I know that people think oh, I know the people at this party, they're safe, nobody's been infected. Obviously, somebody's been infected in those parties. And so please be careful. Please wear a mask when you go out. Please stay socially distanced, and please wash your hands, because people are getting infected from traveling and from going to parties. And then here we're looking at our Erie County case counts by gender and residence. So you can see that as far back as July 6, about a little over half, 56% of our COVID positive tests have been among females, and about 44% among males. And then looking at areas of residence, among those people that have tested positive for COVID-19, 45% have been from the city of Buffalo, as compared to only 28% of our Erie County residents living in the city of Buffalo. So as we discussed earlier, that there is a bit of a disparity there, and we're working with our community partners to try to address this situation. And this is looking at the number of COVID-19 tests that have been done since the middle of March until this past week in blue, and then the proportion that have been positive in orange. And so the good news is, we're still continuing to do a lot of testing. We know it's important to identify people that are positive and remove them from the community and put them in isolation and their close contacts in quarantine to break those chains of transmission. However, you can see with the orange is getting slightly higher each week. So, the past couple weeks, we were really happy that we were only just above 1% of our COVID positive tests being positive, and now we're starting to creep up a little bit. And just like the hospital admissions are starting to creep up, our numbers and our proportion of positive tests are starting to creep up. So remember, COVID-19 is not not gone. And we have to be persistent with these preventive measures of masking, social distancing, over 6 feet away, washing our hands, disinfecting, frequently touch surfaces to keep it down, because we could end up like those other states on the list. Looking at our antibody tests, the numbers that have been done each week and the number and proportion that have been positive, you can see that we continue to see a very low proportion of people in our community testing positive for antibodies. So that means that about a little under 95% of people in Erie County are susceptible to COVID-19. They have not been exposed. They've not developed any antibodies, and many of us are vulnerable. So now we're moving on to the mortality data in Erie County. Do you want to take that, or you want me to take that? Okay, thanks. I'll spritz you.
Thank you, Doctor. This information should not surprise anybody. It's very similar to what we've shown all along, that the vast majority of deaths have occurred in the 70 and above age category. Actually, I'll show you on the next slide that 157 fatalities of the 642 have occurred in the city of Buffalo, which is a little less than 25% of fatalities, and of course the city makes up about 28% of the overall population. 485 deaths have occurred outside the city of Buffalo in the 2 other cities of Lackawanna, Tonawanda, and the 25 towns. And then we have it broken down so you have a better idea on numbers. There's 6 individuals who've perished from COVID-19 in Erie County since the beginning of the outbreak under the age of 40, 9 between the ages of 40 to 49, 28 between the ages of 50 to 59. Once you get over 60, and this is what they said early on, even before we had our first case, is that when we were looking at what happened in China and Italy, it's that it was dramatically impacting people over the age of 60. Then you start seeing the increases in deaths. 84, 60 to 69, 142, 70 to 79, and 373 deaths of people 80 and above. So we just want to remind everybody that while you're younger and your odds of perishing from COVID-19 are much lower, there are individuals under the age of 40 who've died in our community from COVID-19, and just because you may not become sick or ill does not mean you can't pass it on to someone else who could become sick or ill and die from it. And we do know there's cases in our community where people transmitted COVID-19 to a senior member of their family or someone else who eventually died from it, and we want to avoid that, of course, at all costs. Race and ethnicity data, you've seen this slide before, and it continues to trend very similar to what we've seen recently. Whites are making up 81% of the overall fatalities in our community. They make up about 81% of the population. African Americans have made up 16.4% of the deaths. They make up about 14.6% of the population, and then it breaks it down further. So the mortality data is trending primarily by population line, which is very good, because there's other areas of the country where African Americans and people of color make up the vast majority of deaths, much above their population for what they should have in that community. I'll turn it back to the doctor now to talk about testing. Her favorite subject.
One of my favorite subjects. Yeah. So we are still in Erie County doing testing, both diagnostic testing and antibody testing for COVID-19. And I have to say, our lab really rocks. We have a very fast turnaround time. We can get the lab results out in 24 to 48 hours. So our lab is working very, very hard right now. So if you want to schedule either a diagnostic test or an antibody test, you can call 716-858-2929. Just today, we started an online option to schedule for antibody testing, and you can see the website is here at erie.gov/COVID tests. We're also working with our IT to develop an online testing for the diagnostic testing. We haven't done that yet. So remember, this is a no-cost test. It is free throughout Erie County. You don't need any type of lab requisition or physician's order. It is by appointment only, however, our antibody clinics, we are happy to accept walk-ins. We usually, they're very quick, and they can usually take in more people. We have clinics throughout Erie County, and please, if you have an appointment, please show up. You are taking a spot of somebody else, especially for our diagnostic tests. They get filled up really fast, and people really want to get tested, so please show up and don't take somebody else's spot. So our testing sites, we have scheduled through the end of July. We're going to be in Williamsville on Mondays, Orchard Park on Wednesdays. Usually we're going to be at Kensington High School in Buffalo on Thursdays. However, this Thursday is supposed to be extremely hot with a heat index over 100. So to protect our nurses, we are going to bring them back to Williamsville to make sure that they can stay cool, because that is a covered site for them. And if anybody has a diagnostic testing scheduled for this Thursday in Buffalo, if you haven't already received a call from us, please show up to our Williamsville site and give us a call at 858-2929, and we can give you the exact location. But we're just doing this to protect our nurses and keep them healthy and prevent dehydration and any type of heat stress. So for antibody testing sites, again, we're rotating throughout Erie County. We're having clinics on Tuesdays and Thursdays. So this coming Thursday, we're going to be in Irving. Next week, Tuesday, we'll be in Tonawanda. And next week, Thursday, we're going to be in Lancaster. And if you want to find a testing site near you, you can go to our interactive map at erie.gov/COVID test sites and click on one of these purple stars and find out what type of tests are being offered there, if you have to make an appointment, if you need insurance, if you need a physician's order or lab requisition. Pharmacies are included in this map. And so now we're going to talk about how we are responding. So, the governor yesterday added three more states onto the list of states where people should be very, very cautious about traveling to because they have very high rates of COVID-19. So the new states were added were Oklahoma, Kansas, and Delaware. So those are the three new states that were added. So remember, so now there are a total of 19 states. So that's almost half of the United States. So please, people, be careful if you go to any of those states.
I would note we're missing a big one there, which is California.
Oh, thank you.
It's not on there, but it is on the list. And MI is Michigan. It is not Michigan. It's Mississippi, which is MS.
Thank you.
A typo.
So, there are different ways where the health department Erie County Health Department is finding out about travelers. First of all, the New York State Health Department is stationed in the Buffalo Airport, and the airlines are dispensing reporting forms to travelers that are flying in for direct flights from these states that are considered high risk. And so people complete those, and they deposit them in a box at the New York State Health Department's table in the airport, or if they come in on an indirect flight from an airport like in Chicago that was not on the list, but they did travel to a state like California at high risk, they can complete the form themselves and hand it in to the state health department, and they send that information out to us. Also, we have a form on our website, erie.gov/COVID-19 travel form, where you can self-report that you've traveled, or you can report your friends or family or enemies that have traveled, and we are receiving a lot of those too. And we're following up on them. And then also the state health department is they're getting reports from New York PAWS, and they're sending that information to us too. So we're getting it many different places. Over half the reports we're getting from the airports themselves, of people self-reporting at the airports. We are getting quite a number of reports of coworkers, neighbors, family members reporting on other people. Just to let you know of if you want to be a good resident and report complaints about COVID-19 related violations. For the Erie County Health Department, we are taking complaints and investigating them about restaurants, bars, and food services. You can call 716-961-6800, and or there's a form you can complete on our erie.gov/health website. website. All other type of business complaints and locations and incidents, you can either report to the New York PAWS phone number, or they also have an online form, or you can more directly call your municipal building inspector in your city, town, or village, and they can investigate and enforce. And then once again, complaints about travelers, if you want to go through us in Erie County, you can go to our online form at erie.gov/COVID-19 travel form. And so we are receiving quite a number of restaurant complaints. Since the beginning of our COVID-19 pandemic, our Erie County Health Department has received 1,100 COVID-related complaints. As of July 1st, we've received 159. So this has really stepped up. And actually, over the weekend, the long weekend from July 3rd to July 5th, we had 75 complaints that we investigated. So it's been very, very busy for our public health sanitarians. And of those, we've had 9 restaurants that we have already issued violations for. It was primarily for masking, not masking at the restaurants as appropriate. So our public health sanitarians are investigating all these complaints, and as well as doing our regular food inspections. So again, they are very, very busy. So we are calling out restaurants in Erie County, please adhere to these New York Forward guidelines. It's not just a regulation, it's a regulation to keep our community healthy and your patrons healthy and your staff healthy. So please adhere to these guidelines. They're very easy, very simple, and it'll really protect our community and help keep our numbers down. You are an essential part of our problem solving to keep our numbers down. So I'm going to turn it over to our county executive to talk about some other great things that we're doing with businesses.
Thank you, Doctor. Uh-oh, just popped my mask. The Business Task Force, I want to give an update on that. We have a new Erie County Microenterprise Loan and Grant Program, which is 60% grant, 60% loan, 40% grant. Loan amounts from $5,000 to $35,000 with a 2% interest rate on the loan portion. The first payment can be deferred for up to 6 months, and it can be used for working capital or the purchase of machinery and equipment. We know there's a lot of folks out there that still need assistance. I was out with Senator Schumer this morning in South Buffalo talking about the Paycheck Protection Program, but we know that that is not sufficient for some businesses, so we have this program that's available. You can be available to businesses with 5 employees or fewer, which there's some limitations on some of the other programs that are out there. You can basically just have a couple employees and still qualify for the loan under the Microenterprise Loan Grant Program, and it's funded through the Federal CARES Act. Funding is available for businesses located within the county's Community Development Block Grant Consortium, which is 34 municipalities. Amherst, Buffalo, Cheektowaga, Hamburg, and Tonawanda receive their own federal CDBG funding, so this program is unfortunately not available for businesses in those communities. We'd recommend that you contact those communities for CDBG funding programs that may be available in those communities. And for more information on the Erie County Microenterprise Business Loan Grant Program that we just talked about, you can call 716-858-4613 or 716-856-6525, or you can check out information on our website at erie.gov/environment and click on Economic Development for more on that program. And then the ECIDA, through its COVID-19 Emergency Business Loan Fund, offers small business loans from $10,000 to $50,000 with a 2.5% interest rate, interest only for 1 year, and there's $2 million available. $500,000 is set aside for retail businesses, and this program is something that we're also been expanding upon. There's a large business loan fund up to $2 million that's available. I mean, I'm not talking about $2 million of just all loans. It's up to $2 million in total that a business can borrow up to at a 2.5% interest rate with interest only for 1 year. It does require a bank participation and can be paired with our sales tax exemptions for up to $100,000. This is available everywhere in Erie County through the ECIDA, and we want businesses to know that these programs are available to assist them and help them. We were hopeful that we'd be 100% out of COVID-19 by now, but we're not, and we're going to be dealing with this for some time. So we have to have programs available for our local business community. The funds can be used for working capital, accounts receivable, payable, payroll, rent, insurance. And to get more information on these programs, call the ECIDA at 716-856-6525 and ask for extension 219, or you can go to their website at eciday.ny.com. We have a small business funding and resource webinar that is being put on by the Erie County Business Task Force Small Business Subcommittee. Say that 5 times fast. It's not easy. It is next Tuesday, the 14th, from 3 to 4 p.m. It is a webinar, so anyone who qualifies can, as a small business, can participate. You do have to pre-register, and the registration is through the Amherst Chamber of Commerce, business.amherst.org/events. And it'll be providing small business leaders with information they need to know on how to continue to get through this COVID-19 period. While some businesses, of course, have reopened, they're not back to 100% capacity, and others have not reopened yet. So we think it's important that we continue to provide these services to our business community. It will be a good webinar program. I've seen the list of individuals who will be speaking, and they are some experts in the field. I'll turn it back to the doctor to talk about the health fair that's coming up.
Thank you. So the health department, we are still doing bread and butter health department work. So on July 11th, this Saturday, between 9 a.m. and 1 p.m., we're going to be in Cheektowaga at 2910 William Street at the Dollar General parking lot. We're going to be handing out condoms, some masks and hand sanitizer as supplies last. We're going to be giving out Narcan, including the Narcan emergency boxes. We're going to be doing Narcan training. We're going to be doing HIV testing and giving good information around sexual health care. And we're also going to be providing people with good information and linking them up with cancer screening programs. So all our core activities, our information about that is going to be at this health fair. And then we have another one scheduled on August 8th in Tonawanda, so we'll be giving you information about that. But again, I know COVID-19 is such a huge problem in our community. However, we still have cancer, we still have sexually transmitted infections, we still have HIV, we still have overdoses, unfortunately. We can't forget any of that, and we still have to be on target with those issues. So as we all can feel it when we go outside, it's very, very hot outside. I feel like I'm living in Hotlanta again. So there is a heat advisory now because of the extreme heat that we are experiencing this week. So there are cooling centers at the Buffalo and Erie County Public Libraries this week. The library has been very generous in keeping their libraries open for people to stay during the day and stay cool. I mean, when the sun is out, during really the peak heat times, and so people should think hard about getting into an AC, an air-conditioned place. And the Buffalo and Erie County Library is a perfect place to hang out. You can read books. Again, they ask people to wear masks and social distance when they're in the library, but it's a great place to spend some cool time. You should either go on their website or call ahead to find out their hours of operation. Also, please just pay attention to your own body and to your friends and family members and elderly people in the community about signs of dehydration and heat exhaustion and heat stroke. Remember, heat stroke is fatal. It can be fatal. It's very, very dangerous. It can be deadly. So please keep an eye on everybody around you for this possibility. There are ways to prevent these heat-related illnesses. Remember, you want to stay out of the heat, and you want to drink water, stay hydrated. Don't wait till you're thirsty. Kind of time it. Takes a couple of sips of water every hour. Just don't wait until you're thirsty, because usually that is too late. Find cool places with air conditioning. Limit your time outside, especially in the sun. Wait to do the gardening till the evening hours. Please please, when you drive, don't leave any children's or pet in the back seat of the car. The cars heat up very, very quickly, and people who are left in those cars locked up and not being able to escape can suffer some illnesses and even death from extreme heat. So, what I do is when my kids were young, I would always put something in the back seat next to them, just so I wouldn't forget to look behind there and say, oh, there's Zachary or Joshua, I can't forget them. So you can put a purse, you can put a wallet if you don't carry a purse, you can just put something that you need to when you get out of the car, not to forget your kids or not to forget your pets. And also, I know this may not make sense, but you're not supposed to use electric fans when the temperature outside is over 95 degrees, because you're actually just blowing hot air on yourself and making yourself hotter instead of colder. So please try to avoid using those electric fans when it's very, very hot outside. So we're asking people that live in the Snyder, Amherst, Edwardsville area near the Buffalo VA Medical Center to reduce any type of unnecessary electricity use, because there are crews out there repairing damaged electricity equipment. So we kind of go back to the old days, thinking about how to stay cool in our homes without much AC or without much electricity. So things that we can do is try to limit the sunlight in the house, so draw the blinds and the shades and the drapes to block out the sun. Try to control your own home's temperature. Use if you have a smart thermostat, or make sure that the temperature is not turned down too low. Try to get there in the mid to high, mid 70s, 76, 77, and with the AC, make sure that your ACs are working efficiently, and replace and clean the air filters if they're clogged. Temporarily turn off the pool pump if you have a pool. Use oscillating fans, except if it's over 95 out. Make sure, especially people who are very vulnerable, like the elderly, make sure they don't have their fans on, they have permission to keep the AC on. And then also try to delay the use of hot water appliances like your dishwasher or your washing machine. Turn off the lights when they're not needed. That also helps to keep the house cool. And unplug electronics to reduce the phantom load. So I think we're ready for questions and answers. Turn it over to the county executive. Thanks.
Mark, any thoughts
Thank you, Doc. Wait.
the president's announcement regarding schools?
I have no idea what he said. I generally don't pay attention to what he says. I listen to Dr. Fauci.
So,
Ron?
Could we ask a little bit more about contact tracing?
Sure.
The number of cases that we get for determined to be positive per day, can you tell us how many are community spread versus how many are actually from an individual that, say, was a coworker, things of that nature?
Well,
break that down.
What you described would both be considered community spread. The question was, how can we break down through contact tracing, how many are community spread, how many have been through other areas? The general thought about it from when we look at a community spread is, if they caught it here in this community, it was community spread. When we talk about travel, we're talking about out of the area travel. We're talking about to one of these other states, or for that matter, another state where they might not be listed on the 19, but they still have COVID-19. So somebody went to Pennsylvania or Ohio, which are not on the lists right now, but they are seeing increases in their COVID-19. So that would be a travel-related one. Everything else is community spread. But so like.
Understand, say somebody walks in off the street and has a test.
Yes.
And they test positive. They're coming off the street. They haven't been with someone else who had tested positive. In other words, this is a unique case. Can you break that down? Can you differentiate that, again, from the person who's been exposed by someone else?
Well,
I don't really know the source.
I'll have the doctor come up too, but I think you're answering your question, because if somebody comes in and they do not know how they got positive, they caught it from someone else. Who, and if they didn't leave the region, they caught it in the community. Where? That's part of the problem. That's why we do contact tracing, is to try to determine where. It could be as simple as they were at the gas station pumping gas into the car, and the person on the other side of the pump sneezed or coughed and had it and didn't know it, and then gave it to the person. It's community spread. We'll never know the person they directly got it from, because the individual may never know. But our contact tracers are required to then contact the known contacts, the family, close coworkers and the like, to let them know that an individual that they work with had come in contact with it. There are situations when our contact tracers will never be able to determine where somebody got sick. That happens more often than most people think. And that's why we talk about the parties and travel. People are getting it on travel, but they don't know who they caught it from. They're getting it at parties, they believe. Then we have to contact all the people at the party, and eventually maybe we're able to identify someone else at the party had it, but we don't know if we got the right person. So it's not easy. Contact tracing is not a 100% perfect system that identifies every individual who had it and who they passed it on to. The goal of contact tracing is to identify, after we've done the test, who has it. Okay, they tested positive. Now we need your contacts to contact them to let them know that someone they were in contact with has tested positive, so we prevent the further spread. The difficulty is trying to go backwards and identifying exactly the person who they caught it from, and there are situations where you can't. So the goal is, how do we move forward and prevent the further spread of it, and that's where the contact tracers spend the vast majority of their time.
One last point on that, though. Wouldn't that also let you know exactly how many cases you're seeing, new cases, again, new cases coming in, versus cases you already knew about that they had contact with an individual who had already tested positive? Wouldn't that give you a better reading to know where things stand exactly in this community?
Well, I think once again, when we look at it, it's tough to say at any one moment how many people actually have COVID-19. It's very difficult to say because we're not testing every individual in the county. The only way to find out exactly how many people in the county have COVID-19 at any one time is if we tested all the people in the county at once. Can't do that, 920,000 people. So that's why we also look at the antibody testing, because the antibody testing will give us a good percentage of those who've been exposed to the coronavirus and developed COVID-19 in the past. And when we're talking right now about 6% of the population, we're talking about a very small number. We're talking less than 60,000. So I think it's important for the vast majority of the public to understand that just looking around this room and knowing the percentages in the population, the odds are everybody in this room has not come in contact with the coronavirus. And there's less than 20 people in this room for those that are watching on TV elsewhere, because we know the percentages of what they are. So the odds are the vast majority of the people in this community have not contracted the coronavirus, COVID-19. And that's why we try to do our best to identify those who have it presently so they do not pass it on to others. I don't know if you wanted to, or did I do okay? A thumbs up.
I
A
want
thumbs
to
up.
follow up to my question that I originally asked, because the president is threatening to cut funding to schools that do not reopen this fall. Cuomo is vastly against it. I mean, that's huge. You are the county executive. There are several school districts in this county. Are you not concerned by what he is threatening?
The question was with regards to the president's assistance to schools. I don't believe there's really any major assistance that's provided by the federal government to local schools other than maybe school lunch programs and things like that. The vast majority of the assistance that comes from, that goes to schools comes from New York State government. So, and once again, the president, I think we all know where I stand with regards to the president. Nothing in his administration really matters if it comes from his mouth. His own administration basically sits there, and when he tweets or says something, they're basically saying, well, the president didn't really mean it. So I think what really matters is what kind of rules we're going to get from the Department of Education. But as we know, the Department of Education has done very little support of schools on a national basis. The vast majority of funds that come for schools in our region come from school taxes in the state. The federal government is a pittance when it comes to assistance with regards to schools in our region, and it's been like that for a while. But when it comes to what the president says, I think the governor told exactly what needed to be said. It'd be about time if the president just followed the rules and put a mask on and followed the rules and followed what Dr. Fauci's saying, because you got the president saying one thing and everyone's basically ignoring him. We know what's happening. We're in the middle of a political campaign and his numbers are bad. His numbers are horrible. If the election were held today, I think he'd get destroyed. But such is how it is in politics. I follow and listen to what Dr. Fauci says. That's what matters.
Following up on what Marley said, how much cooperation are you guys getting or working with UB, Buff State, Medaille, all of the higher education institutions around here, or the privates for that matter, in terms of what they're planning to do and how it affects what you do, and if they test, are they going to tell you? And is there active cooperation?
The question is there active cooperation between the universities, the colleges, and so forth in Erie County? And the answer is, other than the University of Buffalo providing us statistical data, no. I haven't heard a peep from most of those colleges, because they were basically waiting for the guidance from New York State for higher education, which just came out about a week and a half ago. It just came out. Some of them are, I assume, putting together their plans right now. I think distance learning is, based on the conversations I've had, is going to be key. We see what's happening down south. If all the colleges opened, we know kids, they don't want to wear masks. You're going to have outbreaks in colleges. Most of the kids are maybe not going to get sick, but some of them will. So, but yeah, when it comes to colleges, they're not, I haven't heard much from colleges in the last few months. Sandra, and then I'll come to you, Michael.
Do you have any observations to make about how Erie County fares in terms of its COVID-19 hospitalizations compared with other regions in upstate New York? For instance, it seems like the Finger Lakes region, where Rochester is, seems to have like way higher number of cases, even though their population is lower. And also, you have made previous comparisons to the Cleveland and Pittsburgh areas in terms of their cases. I was hoping you could expound on that.
The question was, how are we comparing with hospitalizations in other regions in New York, and what are we seeing elsewhere, especially our Great Lakes and regional comparables, such as the Pittsburgh area and the Cleveland area? When it comes to upstate New York, as a percentage, we're doing much better than a lot of the other regions when it comes to hospitalizations. I don't have the exact numbers off the top of my head, but I was looking at it, actually doing the comparison yesterday. I didn't see the most recent statistics, but as of yesterday, and I don't think they've changed much, the Finger Lakes region, the Rochester region, has many more hospitalizations. I think it's actually about double the amount of hospitalizations that we have right now in Erie County. The same goes for other areas like the Hudson Valley and the Mohawk Valley. If you look at it based on the population, we're doing much better than those areas, and that's good. I mean, it says a lot about how we've been able to help keep down the continued spread. When you look at what's going on in Cleveland and Pittsburgh, they've seen some pretty marked increases in the last few weeks since they reopened. When they reopened in both Ohio and Pennsylvania, they did a much more expansive reopening. They had phases, but less phases than New York State. And for the longest time, Cuyahoga County in Cleveland had significantly less cases than Erie County did. And just since June 1st, that has changed dramatically, where Cuyahoga County now has more cases than Erie County. And Pittsburgh and Allegheny County has seen roughly a doubling of cases with regards to COVID-19 cases in their region. And they still haven't done the amount of testing that we do here. So we have, I think, compared to our regional group and others in upstate New York, done a pretty good job of controlling the further spread of the coronavirus and COVID-19. But it's important for us to understand that that doesn't mean we have to stop, because what I'm afraid of is what you see happening in the South, where they just opened up and people went partying and the bars were crazy, and now the numbers are skyrocketing. I have colleagues down there that I've talked to, and they're petrified. They're running out of ICU beds. They've reached a point right now where if they can't control the further spread of the coronavirus in some of those communities, they're going to be worse as a ratio, a percentage of their population than we were in New York State and New York City, and that's really bad. Lena Hidalgo, my friend and the county judge from Harris County, Texas, which is Houston, was just on national television talking about it. And I could hear the fear in her voice, because I talked to her personally a couple days before, and she felt the same way, like, Mark, we're running out of hospital beds. So we've done a pretty good job here, but we can't stop just thinking, yeah, it's done, because we see what's happening in the South. And I think the Allegheny County, Pennsylvania, where Pittsburgh is, and Cuyahoga County, Cleveland, where Cleveland are very instructive. Because while they're a little larger, both those counties have about 1.2 million in population, and we're about 920,000. They are larger. They're not that different from our community. They have a central city. They have an inner urban core, and then they have suburbs and some rural areas. So what happens there is instructive of what could happen here if we don't continue to follow the appropriate guidelines.
But you don't attribute their increase in confirmed cases to increase in testing?
Well, no, I don't think it's because of increase in testing. If I remember, actually, I could probably pull it up on my phone right now by looking at yesterday's tweet that I did. This is the advantage of carrying the phone. Oops, I don't want that. Profile. But I can look, and I know that when it comes to Allegheny County, I see now I'm getting all the tweets from today. Oh, here we go. It's almost there. Oh, I'm missing it. As usual, just when I need it, I can't find it. I'll get you the numbers. But I do know that the number of tests that have done in Allegheny County are substantially less than what we've been doing in Erie County through this point. Actually, I don't have it, unfortunately, in this one right here. I can get it to you later today because I do have the exact numbers in Allegheny County as of yesterday. I think it was around 66,000, where we're like 155,000 tests. It's not just because of new testing, it's because they reopened earlier, they reopened quicker with regards to their phase plan, such that Allegheny County on July 3rd through July 10th, they did a shutdown of bars and gyms and other facilities that had been open again, indoor dining and restaurants, because they were so afraid of the growth. Rich Fitzgerald, my counterpart in Allegheny County, I've not talked to Rich directly in the last few weeks, but I've seen his order, and it basically was, we have to shut down what was something that was open because our numbers are going much higher than they should. Michael?
What role do you anticipate Erie County playing in helping schools to reopen? We're getting a little bit more guidance from the governor's office. We're going to learn more information later next week regarding guidance that comes out. What role does Erie County play in helping schools to reopen? And also with the malls, because that news is coming.
Well, the malls, the governor announced earlier today that the malls will be able to open on July 10th if they have the appropriate HEPA HVAC system in place. We do not have the guidance from New York State yet. I assume we'll get it because then we're going to get questions on enforcement. The schools are an interesting type of organization because we generally don't have a direct relationship with them, but we were working with them early on during the COVID-19 crisis, giving them recommendations on whether they should close or not, such that the first order of closure came from me, in which I shut down all schools in Erie County. And then they decided just to shut down themselves before finally the governor shut them all down. We are going to work with the school districts with regards to advice. I'm hopeful that the schools will be able to open in September with students back. We all are. I don't know. Nobody knows. But we're still waiting. The schools have not received guidance from New York State yet. Higher institutions have, like colleges. Trade schools have. But primary, middle school, high school have not received guidance yet from New York State. And I would remind everyone that it's the New York State Education Department that really controls school districts. If the New York State Education Department says you have to split your classes in half, so if you normally had 25 or 28, let's say, students in a class, now you have to have 14, they make the decision. We don't. We'll discuss that with the Department of Health with them, but in the end, it's really going to be a decision made by the New York State Education Department telling the schools what they need to do, and we'll help schools try to come up with a way to meet the plans. I'm hopeful that they all will. But for some of these very large schools, my nephew just graduated from Orchard Park at a class of over 400. If they said they have to limit the number of students in each classroom, I don't know how they're going to do it, really. I just do not know, based on the size and the amount of people and the students that are in a school, how they're going to be able to do it. When I went to Lackawanna in the mid-'80s, my junior high burned down when I was there, and we did split sessions. It was no fun. It sounded great, but it was like 7 o'clock in the morning till I think 12:30, and then it was like 2 to 7 at night, having the middle school and the high school in one building, because my junior high burned down, Hoover Junior High. All the Lackawanna folks will remember it. And I was a student then when the school burned down. So every kid who wishes that their high school would burn down or their school would burn down, it's not a good thing. I lived through it. But maybe that's something that's going to be on the agenda. And I've heard that discussion behind the scenes that split sessions might have to be on the agenda. And at this point, until the state issues its guidance, Michael, it's all conjecture at this point.
Sure, and as we prepare for the state to give out those new guidance, I mean, do you think that Erie County is in a position to offer anything from PPP testing in the schools, or is that going to be allocated somewhere else within the county and you're going to have the states rely on it, or is it too soon to say?
It's too soon to say. I don't know what the rules are going to be with regards to testing in schools. I don't know what the requirements are going to be for PPE, though I'm fairly confident they would probably require students and teachers and staff to wear masks while they're about the school. Are they going to require them to wear masks when they're in a room? I don't know. They might.
Can you talk about
Let me go to Eileen. She has this question yet.
Can you talk about the 9 businesses that received the violations for face masks? What happens to them when that happens? Are they just given a violation order? They didn't have to shut down or anything like that?
I do not believe they shut down, but I'll turn it over to the doctor because she can go more into it.
Sure. So of the 9 businesses that, restaurants that we issued violations, these violations, these are first-time violations, so it's just a fine. And then, but they can, if they have, repeated violations, we can, up the fine, and eventually, they may have to close depending on what they're doing. But we start off with a fine.
How much was it?
The fines can be as high as $500 per day until they demonstrate compliance. So I don't know exactly with each facility how much they were fined, but it can be up to $500 a day.
And the Boys and Girls Club sent us a statement saying that basically it was two workers unloading a food truck. They had masks on, but they were below the nose. Can you talk about that? Because is it the fact that people aren't wearing them at all in these organizations or restaurants, or that they're wearing them improperly?
Well, I mean, we look for compliance with mask use, so that would be people wearing a mask and people wearing a mask properly. Because if you're not covering your mouth or your nose when you're wearing a mask, what's the point? So, we're looking at that. And again, I haven't seen our public health sanitarian's exact report yet, so I can't say like if they were not wearing masks or how much they were not wearing masks. But however, our public health sanitarians are very, very astute and they're very good. And if they determined that they were out of compliance with wearing masks, they were out of compliance.
What kind of a strain is that putting on those public health inspectors, given that they're doing their kind of normal routine inspections, but is it just part of now COVID inspection is part of that regular?
Right. I mean, they are very, very busy. However, the summer is always the busiest season for food facility inspections, because normally we have all these different carnivals and festivals, and they all have food, and so we're very, very busy during the week and every weekend in inspecting all those temporary food facilities. And so we don't have those this summer. Instead, we have our inspecting and investigating the COVID-related complaints. So it is a very busy time.
Which 9 businesses were they?
We can send that to you. It was Seneca Red Hots in Buffalo, Armor Inn Tap Room in Hamburg, the Boys and Girls Club of Buffalo on Babcock Road, the Cowboy Club, or the Cowboy in Buffalo, La Davina Uno in Kenmore, John's Pizza and Sub in Amherst, Joe's New York Style Pizza in Buffalo, La Casa de Sabores 1 Incorporated in Buffalo, and the Anchor Bar in Buffalo.
And these were all mask violations?
Yes, yes. And again, as since the start of the COVID-19 event, we've had 1,100 COVID-related complaints, 159 just in July, and then over the weekend from the 3rd to the 5th, where there were 75 inspections done.
Dr. Burstein, to follow up,
Mark, did you have something?
Well, yeah, I was just the one thing I want to note is that our health inspectors are going out there for a reason. They're going out there to protect the general public, and we've had some people that they're talking to as part of the businesses and other like who've not treated them well. And I'm telling you, if you assault or do something to one of our health inspectors, I will ensure that you're prosecuted. Because we've had some situations where health inspectors have been treated very poorly by business owners and public officials, and I will not tolerate it. If I get word that a health inspector is touched, if I get word a health inspector is pushed, if I get word that a health inspector is treated very poorly, remember, especially in a restaurant and a bar, you have that certificate on your wall from the Department of Health, and that could easily be revoked. So to those that are out there and thinking, I don't care about what these health inspectors say, they should care. Their business may be dependent upon that health certificate, and if there are violations, we're going to note the violations. We're doing this to protect the public. It's not like we want to go out there and just fine people thinking, oh, it's just a way to capture money. It's not. Our health inspectors, like others right now, everyone's still dealing with this issue, and it's a legitimate issue. So if businesses or others are going to treat our health inspectors poorly, such to the point where they're reached a level of physical violence, trust me, we'll ensure that you're prosecuted.
Mark, following up on something you were saying with the statistics, the two big anomalies in these statistics from the beginning is a very low rate of COVID, apparently, among Latinos, and no reports of COVID cases on the Erie County side of the Cattaraugus Reservation. Well, Cattaraugus, the Seneca Nation says they've had people die, including some well-known elders, but you're doing an antibody test at Irving. Does that suggest some flaws in the testing? I mean, I can't believe that the Latino rate of infection could be much different from the Latino. I mean, we're getting, you know,
It's
are we dealing with people whose
well,
immigration status?
first off, I would remind, the question was with regards to percentages on Latinos who are testing positive and so forth, and the Seneca Nation. One of the problems we've had from day one is getting accurate information about individuals with regards to race and ethnicity when they're tested. If they've deceased, we generally will know that because we're going to get full accurate information on the individual. But the testing, especially from a lot of these private labs, they're not recording the information as they should. I saw there was a very big article in the New York Times in the last few days about the number of individuals who've tested positive as African Americans, other minorities. And one of the big things was, but 50% of the tests do not identify what the race is for the individual. And we've had that same problem here. If it's getting tested by Erie County or the New York State Department of Health one on Perry Street, we're recording the information. If you go to your CVS or some of these pop-up clinics that are elsewhere, they're doing a pretty bad job of keeping accurate information on who's tested. So we've always said from day one, the percentages of the overall tests with regards to race and ethnicity, we can't really say is 100% accurate because 50% of the data we're not getting. On the deaths, the mortality data, we feel very comfortable that the information is accurate because we know who died, we know their race and ethnicity. But the testing, we don't. So you bring up a good point with regards to the Seneca Nation. We haven't seen a whole lot of Seneca Nation and are testing positive. But that doesn't mean there aren't people that are positive there who had it. And one of the reasons why we're doing antibody testing in Irving, which isn't really even in Erie County, Irving's in Chautauqua County, but that's where their offices are. The reason we're doing it there is because we do believe there's a higher risk of having past transmission on the reservation. And so working with the Seneca Nation, we're doing this antibody test, so that we can get a better idea of what the actual percentage of COVID-19 on the reservation might be.
In terms of the state travel quarantine, do you have an idea? Do you know how many people are currently being quarantined from traveling in Erie County?
Well, we have roughly about 500 people that we have a name for and we've contacted and reached out to. I don't know the exact number that are quarantined. I do know of individuals who traveled and are quarantined even if we didn't contact them because they are following the quarantine order. I would expect that there's more than 500. I would expect that there's maybe even over 1,000 who've traveled recently to those states. As I said last week, if you are thinking of traveling to one of those states, you really want to postpone your visit. If you can't postpone your visit, you're going to have to quarantine.
Are you aware of anyone that has been breaching quarantine, or?
Myself, I'm not aware. Has it happened? Probably.
Is there any repercussions for that, or not really enforceable at this time?
I mean,
It's not a mandatory, it's a voluntary quarantine. And I would hope that people would follow the quarantine or requirements, so to speak, even though it's not mandatory. Because there's a legitimate reason why it's being put in for those states, because they've seen a tremendous growth. I mean, even like Idaho. I don't know how many people travel to Idaho from Erie County, but maybe they do. Maybe a couple do to visit family. But right now, Idaho's got a pretty sizable outbreak. It may not be tens of thousands of people, but based on its population, it's a higher percentage. So there's a greater chance that you'll catch it if you go to Idaho than probably right now in Buffalo, just because our percentage in the community in the region is much lower. Take a few more questions, Michael.
Got any comment about the New Era news that came out?
Yeah, I'm very disappointed in New Era. After the layoffs that they did in Derby, they took the PPP. I think the PPP expired, and then they laid off about 117 people from their office in Buffalo. I'm exceptionally disappointed with New Era. I've not had an opportunity to talk to Chris Cook, the owner. I've talked to Chris in the past during Derby. He's going to make his decisions he's going to make. I'll make our decisions that we have to make. And I'll say this, after seeing everything that we've dealt with in New Era, whenever we have negotiations on the stadium, I don't believe we're going to give stadium naming rights to any Bills organization that can sell them and then have an organization treat our community as poorly as New Era did. Their name should no longer be on the stadium if they're going to continue to lay off our employees and say, sorry, it's not. The heck with it. I'd rather see the stadium called Veterans Stadium than New Era. I won't even use that name. I still call it Ralph Wilson Stadium. I'm just a little disappointed in the way New Era has treated our community. That company would not exist without the hard work of the people of this community. Yes, the Cook family has been the owners and started it, and I understand, but the people who worked there from this community since day one put their sweat and tears into that community, including those that worked at the facility in Derby that were laid off, and now all these individuals who worked in the headquarters. Yeah, business is tough, but the day after your PPP timeline expires, then lay all these people off, that's bad faith. And I will not use that name associated with the football stadium anytime soon. It's going to be Ralph Wilson Stadium as long as I'm county executive or Veterans Stadium. That'd be a better name. So sorry, Bills. I know you're probably not happy with me right now, but that name should not be on the stadium.
I know we talk about this region having, going through a renaissance right now. This is obviously major news in the business community. Do you foresee there being a significant long-term impact?
Well, for the 117 individuals in our community who were laid off, yeah, it's a significant potential impact for them. You don't want to see anybody lay off anyone. I know it's difficult out there. There's a lot of companies that are hurting that are still paying their employees that at least aren't, even if they furloughed them so that they're technically unemployed but could be called back, at least they have the opportunity. These employees are basically, they're told, go find another job. And it's maybe in the grand scheme of things not the biggest layoff that we could have had, but it's not great. It sends a bad message. And I would hope that as we move forward, and we are moving forward, that companies understand that we are in a different time era. It is different. I'm never going to say that a company can't lay off people. New Era can do what it wants. It laid it off. But that doesn't mean our football stadium out in Orchard Park should have its name on it. After they laid off the people in Derby, and now they've laid off 117 people that come from this community at their headquarters. After receiving the money that they got from the PPP to keep the jobs, be a good corporate citizen. I don't expect every corporation to do the thing that's in the best interest of the greater community. If it varies with their own individual interest as a company, I'm not naive, but that was very disappointing to see. I understand if companies have to lay people off. because there's just like the Buffalo Bisons. I mean, the Buffalo Bisons had a legitimate reason to lay people off because there's no baseball season. Minor league baseball is gone. But I guarantee you, next year, we get minor league baseball, the Bisons are going to hire those people back. What New Era said is, we're laying you off permanently. And that's not a great message.
Is there a legality with that, with the PPP, that if a company got, I mean, we see that these companies got between 1-2 million more in funding to help their employment, and then they're laying people off at the same time?
There's a question as to the time span, and one of the reasons why Senator Schumer was in Buffalo earlier today was to talk about expanding the PPE, or PPP. PPE is different. PPP, the Payroll Protection Program. The Payroll Protection Program may have expired, and if so, they had to keep their employees through the Payroll Protection Program period. Now, I don't know how many employees they listed they had that were part of the payroll protection. They had furloughed a lot of people off, and now some of them will be coming back, others will not. I'm sure members of the business community will be mad at me saying, oh, you should never criticize a local company, no matter what they do. Well, the hell with it. I lived in Lackawanna. I watched what happened with Bethlehem Steel and the decimation of our community. That company's not like Bethlehem Steel. But for those 117 people that are losing their jobs, that we're expecting to go back to work as things were picking back up, it could be pretty devastating. So I don't know the exact rules with regards to that company, when they applied, how long they had to do it. But my understanding is it had expired, and what Senator Schumer said earlier today is they were only required to keep the jobs through the PPP program, period. Once it expires, they could do what they wanted. And if that's the case, and they basically outlived it by a day and then they laid the people off, well, that's kind of bad pool, as we like to say. It may be legal, but it's not good. Any other questions?
Is the health department going to be inspecting the malls in the county before they are allowed to reopen, try to make sure that they're compliant?
I don't think we have any obligation to do that. If there's a restaurant in the mall, we'd have to inspect the restaurant. But the mall itself, no. But I have not seen, the state has not issued guidance yet on the malls. The governor made the announcement earlier. I'm hoping to learn a little bit more in 20 minutes when I'm on a phone call with the lieutenant governor and others from the governor's staff at 4 o'clock. So I'm hopeful that they'll have some more information. But right now, when it comes to malls, the only thing that we would be required to inspect would be the food service, nothing else. And
The municipality building inspectors.
Building inspectors, as the doctor noted, might have some responsibilities. But in general, we would not normally inspect a mall. And when we're going out on these inspections, it's inspections associated with food service, or those that get certificates from our health department. So a restaurant we inspect. A place that provides dinners we would inspect, like a club. But something that is not normally under our purview, we just wouldn't go out and inspect because we truthfully don't have the power to do it. In a mall in itself, we would not normally inspect. Thank you, everyone. Wear your mask. If yours breaks and rips like mine, I'm going to put this over, and hopefully I can get upstairs. And I got lots of other masks, but everyone.
Fashion cloth mask.
I can't find a mask that fits really good in these fashion cloth masks like Doctor has. Every time I do